Hey guys, welcome back to Medical Mondays. Happy Monday. So today we're going to talk about SMA syndrome. So what is SMA syndrome? SMA syndrome stands for superior mesenteric artery syndrome. It's caused by an obstruction of the third and fourth portion of the duodenum because of a compression between the superior mesenteric artery and vein. Now, patients typically develop SMA syndrome because they've had rapid weight loss over a short period of time. So what does the anatomy look like? So here we have a 3D model of the upper GI tract. So the esophagus is missing, but you can see where the esophagus would empty into the stomach. The stomach gets food ready for the intestine. And so here, this is the first portion of the intestine called the duodenum. The duodenum has 4 different parts. The third to fourth part is where the SMA and the SMV sit. So the superior mesenteric artery and the superior mesenteric vein. If you lose too much weight too fast, the fat pad between the superior mesenteric artery and vein can disintegrate to the point of which it's causing an obstruction or sandwiching of the duodenum. So how do patients present when they have SMA syndrome? They usually come in with upper abdominal pain, nausea, and vomiting. Sometimes liquids go down okay, but certain foods, especially high fiber or chewy foods, will cause pain and discomfort and vomiting. The best way to diagnose SMA syndrome is with 2 tests. The first one is an upper GI with small bowel follow-through. So you drink contrast, you take live pictures, and you should see an abrupt transition or an obstruction at that third or fourth portion of the duodenum. The gold standard way, the Hallmark test that we use for SMA syndrome, is actually a CT scan of the abdomen and pelvis. So when you perform a CT scan, the distance between the aorta and the SMA is usually less than 8 millimeters, and or the angle between the aorta and the SMA is less than 22 degrees. So what are the different treatment options for SMA syndrome? The one we commonly know is what's called the strong procedure. The strong procedure is essentially a mobilization of that third, fourth portion of the duodenum so that all of your intestine sits to the right of the SMA and the SMV. So the only portion that actually crosses the midline is the third, fourth portion of the duodenum and the first portion of the jejunum. So by dividing the ligament of Treitz and further mobilizing the duodenum and the first part of the small intestine, the first part of the jejunum, everything comes here so nothing can go behind the SMA and the SMV. The second procedure is essentially a bypass. So we bring up a loop of the jejunum, we attach it to the duodenum so that food goes directly into the intestine from the second or third portion of the duodenum and doesn't have to go through that area where the obstruction sits. The issue with that one, it does have a high success rate as far as obstruction goes, but you're still compressing the duodenum in that area. So we do a modified procedure where we do a combination of the 2. We do a strong procedure, so we shift everything over, and we also do that bypass. And with that approach, we have a very high, greater than 90% effectiveness with this operation and amelioration of symptoms. The last thing I'll mention is that there's typically something that caused the rapid weight loss. So in addition to doing the procedures and diagnosing what we talked about, you still have to make sure you find the original source of why this all happened. On that note, I wanted to thank you all again for joining us on Medical Mondays. Happy Monday, have a wonderful week, and we'll see you next week.